Good morning, namaskar, and welcome to Apollo 24/7's Health Hour, where we bring in experts from Apollo hospitals to this live session. And you can participate in the live session by asking your questions. You can post your questions on YouTube chat. You must be watching this on Facebook pages. But if you want your query to be answered, I request you all to type in your query only on the YouTube chat box. And if you're participating in the show, if you want a question to be answered, I request all the audience to type in all possible details in one question box only, and with age, gender, and other details, possible details, into one question. Kindly put everything there so that I can understand and read the question in one go. And in case there are multiple questions of the same genre, we'll take one question and I'll read out all the questions which fall into the same bracket so that everybody gets a chance to answer or address their query. So that's about how you participate in this show. And today we're going to talk about tuberculosis. How can we cure it fully? And how do you understand what tuberculosis is? What does it do to you? All the questions around TB, tuberculosis, kshaya, hum log. So today we're going to have two experts also on this show. Please listen to them very carefully, where we have a health quiz. You can answer our questions and win prizes. And the doctors will be answering questions from you. That those are going to be posted on YouTube as well. चलिए आज के हमारे एक्सपर्ट्स से मिलते हैं. Let me introduce our both experts. We have a consultant infectious disease and also a senior consultant pulmonologist. Here's our first expert on the show. Today we have Dr. Nikhil Modi, a senior consultant pulmonologist and critical care from Apollo Hospitals, Indraprastha, New Delhi. With 15 plus years of experience, Dr. Nikhil Modi can be consulted for sleep disorders, sleep apnea, pulmonology, lung biopsy, lobectomy, critical care, COVID, tuberculosis, respiratory medicine, asthma, and COPD. There, Dr. Nikhil Modi has come back. Namaskar, sir. Welcome back to the show.
Namaskar. Yeah, my
Happy to
pleasure.
have
Thank
you.
you.
Thank you, sir. Thank you so much, Dr. Nikhil. And here I take pleasure inviting our consultant infectious disease. Our expert on infectious disease today is Dr. P. Vishnu Rao, Apollo Hospitals, Jubilee Hills, Hyderabad. Say, Dr. Vishnu is going to join us with an experience of 7+ years. Dr. Vishnu Rao can be consulted for HIV/AIDS, sexually transmitted diseases, fever of unknown origins, post-transplant infections, nosocomial infections, multi-drug resistant bacterial infections, and also tuberculosis, which is going to be the main discussion for today. Good morning, Dr. Vishnu. Welcome.
Good morning.
Wonderful. So both our experts today have already been on this show while we were talking extensively about COVID a couple of years ago when we started our face off with the pandemic. And I thank you both for giving us positivity and giving us information while we were all blinded and dark. And today I welcome you back onto the show with this most important but most neglected and the least aware topic, the tuberculosis. इसके नाम से डर लगता है, लोगों को डर लगता है. I think that's the reason why people don't talk about it much. So let's take, I have so many questions. Even before I started the show, doctor, I switched on the YouTube to see how many participants are there. You will not believe, 5 minutes to go to the YouTube live, we had 1.3 people waiting to ask their questions. So 1,300 questions already. That means people are waiting, soaking for awareness and information. Dr. Nikhil, let's start by telling what tuberculosis is and how do we understand tuberculosis, how dangerous this is.
So, Jhansi, if we start talking about tuberculosis, people first needs to understand that it's an infectious disease. That is, it is a type of bacteria only, behaving slightly different from other bacteria. That it's a chronic infection. That is a long-term infection which persists.
Okay.
And once the bacteria enters your body, it mainly enters through your airways into the lungs. And but the symptoms and the disease may not be restricted to lungs only. It can spread all over. So most of the time, because it enters the lung, so you develop an infection in the lung. So most common symptoms you see are cough. That's why if you see the government also says if you have a cough for more than 2 weeks, you should get evaluation done for tuberculosis. Further, cough may be dry initially or with some sputum. Sometimes even blood can come there. A low grade persistent fever. Sometimes fever cannot has a trend in which evening rise can be seen, and weight loss, loss of appetite. These are the most common symptoms which we see in most cases of tuberculosis. But since this bacteria, once entering the body, can go to other organs, so it may go to bone, causing bone pains, swelling of joints. It can go to brain, causing seizures, headaches, and even loss of consciousness. And if goes into the spine, stiffness of the spine, spine TB leading to paralysis and of different areas of the body depending on where the nerves are involved. Can go into the abdomen, causing abdominal TB, in which obstruction, fluid collection in the abdomen, and all these things can be seen.
Okay, so let's understand that this is caused by a bacteria which could spread all over, and then that's the damage that it is causing within the internal organs as well. So, Dr. Vishnu Rao, I would want to start off by understanding the nature of the spread of the bacteria. Contagious, infectious is what we call, and how fast that does the spread. Now that people are aware of the pandemic, now we understand how a virus can control the entire world. How come tuberculosis, while being there for so long and being contagious, has not garnered enough of our human attention?
Yeah. So basically, we need to understand that tuberculosis spread by airborne method, where typically somebody who has an active pulmonary tuberculosis, he tend to cough, and when someone inhale it, you're going to get it. So what is most important is that not everybody who inhales tuberculosis, they can develop active disease. It's not
Acha.
everybody who inhales develop the active disease. For example, if one person has inhaled tuberculosis bacilli, three things can happen. Number one, your body can eliminate it. Number two,
Okay.
your body, yes, your body can control it. That is called TB infection. That is called latent tuberculosis. Meaning to say that after you inhale that bacteria, your resistance mechanism kicks into and try to control the bacteria. It forms something called as granuloma, and then organ, it completely stops the infection there. That is called latent tuberculosis. That is called TB infection. You need to understand that one third of the world population are TB infected. That means you are exposed to the disease and your body controlled it. And few of them can develop into active disease. Now, we need to understand that once somebody is infected with tuberculosis, only 5 to 10% of the people, they develop active disease throughout their lifespan. And out of those, half people develop the TB after exposure in the 2 years. And TB tend to develop in somebody who has weakened immunity. For example, growing age, diabetes, HIV, immunocompromising conditions. All these can contribute to the reactivation of tuberculosis. So, in fact, when somebody has tuberculosis, the two common things what we test as per the government of recommendation, Indian recommendation is test for diabetes, test for HIV. So these are the immunocompromising conditions that will make a person more prone to develop active TB after getting infected with the tuberculosis. In fact, since
Right.
everybody, those who got infected want the disease, so that's the reason it is very difficult to eradicate it because most people are asymptomatic. Only 5 to 10% of those infected, they develop the disease.
Okay, so while understanding that, there are three things. One, they're exposed to the bacteria. Two, it becomes one. So exposed to bacteria, body flushes it out. Two, it could be latent, and three is an active phase. Dr. Nikhil, I want to understand what are the symptoms or the signs that one can look out for, if there is any, in all these three phases.
See, if the body is able to eliminate the bacteria, it is not going inside the body, so no symptoms are there. Even in cases of latent TB, Dr. Vishnu will agree with me that once even the bacteria goes, the immune system is so strong that it suppresses the thing. So again, there will be no symptoms. In fact, because in our country, so many people are already exposed to that, so we don't treat latent TB at all. We leave it like
Acha.
that. And only those who develop an active disease, which may be on exposure to a fresh tubercular bacteria, and sometimes once the body immunity goes down, this latent TB infection can get reactivated and can then spread the and then start producing the signs and symptoms. So only in those cases, those are the one who require a proper treatment.
And what are these signs, Dr. Vishnu? Can we look out for something very specifically that this might lead to TB?
Yes, I mean the symptoms. It's based on the what organ it involved. When tuberculosis involve lungs, you can get fever, weight loss, loss of appetite. These are called we call constitutional symptoms. We tend to see these symptoms TB anywhere in the body, and if it is localized to lung, then you get cough, like more than 2 weeks. You may get at times blood in the sputum, right? We call hemoptysis. For example, if it is in the brain, you can get headaches. You can get seizures, and you can get if it's severe enough, it can cause unconsciousness and even leading to coma and death. For example, if it is in the lymph nodes, there's the other common area. Typically, we see in young females, lymph nodes here. You see big swellings in the neck. That is one of the other presentation. Then if it is in the abdomen, you will have distension of the abdomen. And if you have in the bone, you have swelling in the spine. Spine is one of the commonest site of tuberculosis when occurs in the bone. So typically you have back pain, swelling, and at times there the bones can fracture and we see something called as deformities there. So all
Yes.
of these are the symptoms. So for what we need to understand is that since the symptoms pertaining to each organ is different, but most patients tend to have constitutional symptoms. So loss of weight, loss of appetite, evening rise of temperature, plus symptoms pertaining to the organ system where the TB is there. So along with these symptoms, when somebody has, you should suspect tuberculosis.
Very, very valuable points there to find your symptoms and bracket your symptoms. Do spread this awareness in case that you know of somebody who has these symptoms. Please do go ahead, spread the message, which is very important. Dr. Nikhil, the commonest kind of, if I can go back to the era 40, 30, 40, 50 years back, ये टीवी जो ऐसा फैला था, इतना डर था, और ऑफ कोर्स अभी भी डर है, आई विल नॉट से, बट नाउ इट्स स्टिग्मेटाइज्ड. नाउ वी हैव पुश्ड एवरीथिंग अंडर द कारपेट. नोबडी वांट्स टू टॉक. पहले लोगों को आइसोलेट किया जाता था. इफ यू रिमेंबर, टीबी इज known to be the chest infection only at that point. We never knew so much of information that TB could be presented in multiple organs of the body. So as we used to think कि वो pulmonology का ही एक डिसीज है, अभी क्या क्या फर्क है, एंड स्टिग्मा अभी भी एग्जिस्टिंग है क्या, आइसोलेशन की क्या जरूरत है, एंड हाउ लॉन्ग विल द कॉफ परसिस्ट?
या सो अगर हम स्टिग्मा की बात करें तो डेफिनेटली स्टिग्मा अभी भी लोगों के माइंड्स में बहुत है. स्टिग्मा इतना ज्यादा है कि लोगों को कहो कि आपके सिम्टम्स लग रहा है कि इट कैन बी ट्यूबरकुलोसिस, वो कहते हैं नहीं टीबी तो हमें हो ही नहीं सकता. दे आर नॉट रेडी टू एक्सेप्ट दैट इट इज ट्यूबरकुलोसिस. फर्स्टली आई वुड लाइक टू से 40-50 years बैक डर शायद इसलिए था कि दे वर नॉट गुड मेडिसिन अवेलेबल. And now we are in an era in which multi-drug resistant TB. For that also we have so many good medicines available with incoming of newer drugs like bedaquiline, delamanid. तो अभी जो इतना अच्छा ट्रीटमेंट हो गया है तो नॉर्मल जो टीबी जो होता है वो भी ट्रीट हो जाता है, मल्टी ड्रग रेजिस्टेंट भी. पर उसमें प्रॉब्लम क्या आती है कि इतना लंबा जो कोर्स होता है, एटलीस्ट 6 months का नॉर्मल टीबी का, 18 to 24 months का फॉर एमडीआर टीबी. So most of the patient, once 2-3 months down the line, they start feeling better. Some of them stop, and then the relapse of disease which comes is more dangerous, more harmful. Also, I would like to say TB is totally curable. Just trust your doctor. He will just guide you proper, and you don't need to stigmatize this disease. Yes, if you have an active tuberculosis of the lungs, so a person who has active tuberculosis in his sputum, the bacteria is positive. He can definitely spread to person around him. So for that, maintaining a proper ventilation and sunlight in the areas where the person is staying, anybody going close to him wearing a mask and maintaining a proper social distance, which we in fact have discussed many a times for COVID. So with these simple precautions, you can prevent others being contaminated by the disease. And usually once the treatment starts, within few weeks, your bacteria starts dying, and then the chances of it being spreading to others reduces, and then it becomes totally safe even to be around them.
So ये क्या time है that Dr. Vishnu, let me understand how long one can be contagious once they have active tuberculosis. So airborne है, that we understand. So we have learned hard way. One pandemic has taught us our sanitary hygiene measures. So what? How does mask help? Does frequent hand wash help? What else helps? And how do you safeguard your own community?
Yeah, the most important thing is that we need to understand is the pulmonary tuberculosis that has a chance of spreading to others. So TB
Yes.
elsewhere in the body doesn't spread to other persons. So when somebody has tuberculosis, early diagnosis and treatment is most important, because once you start on treatment, the sputum get the infectivity will almost reduces to significant extent within 2 weeks. In fact,
अच्छा.
after starting the tuberculosis treatment, you are not only going to get better, you're going to stop transmitting the disease to others as early as 2 weeks.
Two
Such is the
weeks.
powerful 2 weeks, minimum 2 weeks. After 2 weeks, generally the transmission will be very, very, very minimal. So that is what we need to understand. And to prevent the spread, since we need to understand this is an airborne disease. So
जी.
airborne means once you cough, these TB bacilli can stay suspended in air for longer duration of time. So
जी.
that's the reason. What is important is, if you have a TB patient, the simplest thing what we tell is that open the windows, let you have a good flow of air. Good ventilation is what that is required. Staying in close areas. So that is something increases the chances of having a spread of tuberculosis. So the simplest thing is, when somebody has TB, diagnose it, treat it, take the medications promptly, and use always mask, and make sure that the patient is in a well ventilated room. This is the best thing what we can do to prevent the transmission of tuberculosis.
नाइस लवली थैंक यू सो मच फॉर दोस टिप्स डॉक्टर विष्णु डॉक्टर निखिल जी ये हमें बताइए कि ये जो ट्रीटमेंट आपने बताया कि लंबी देर तक चलता है तो क्या हो सकता है कि ड्यूरेशन पेशेंट टू पेशेंट बदलता है या ट्रीटमेंट प्रोटोकॉल से बदलता है ड्यूरेशन क्या हो सकती है ये अगर आप हिंदी में बताएं तो
या ड्यूरेशन ऑफ ट्रीटमेंट जो है ये आफ्टर सो मच रिसर्च सो मच स्टडीज एक स्पेसिफाइड ड्यूरेशन बनाई गई है. So a normal TB, 6 months duration is good enough. For MDR TB, it varies from 18 से 24 महीने का ट्रीटमेंट होता है MDR TB का, जो न्यूअर ड्रग्स के साथ होता है, और 6 months मिनिमम ट्रीटमेंट है. बट देयर आर कुछ कुछ स्पेसिफिक फॉर्म ऑफ टीबी होते हैं. जैसे अगर हम ब्रेन टीबी की बात करें, जैसे हम बोन टीबी की बात करें या स्पाइन टीबी की बात करें, तो बोन्स में ब्रेन में मेडिसिन क्योंकि स्लो जाता है, इफेक्ट ज़्यादा सीवियर होता है, तो ट्रीटमेंट ड्यूरेशन 12 to 18 मंथ्स भी होता है इन केसेस में. सो ऐसे स्पेशलाइज जो आपके जो एरियाज इन्वॉल्व होते हैं, तो इस केस में आप जो है हमेशा गाइडेंस अंडर प्रॉपर गाइडेंस लीजिए. वरना जो डॉट्स ट्रीटमेंट होता है वो नॉर्मल टीबी वो 6 मंथ्स ड्यूरेशन का होता है, बट मेनली वो हम पल्मोनरी टीबी, लिम्फ नोड टीबी, चेस्ट में पानी वाला जो टीबी होता है, इन सब में 6 मंथ्स में काम हो जाता है. बट बोन टीबी, स्पाइन टीबी और ब्रेन टीबी, इसमें यूजली ट्रीटमेंट लॉन्गर होता है. तो इस चीज़ का ध्यान रखना चाहिए और हमेशा अपने डॉक्टर से कांटेक्ट में रहना चाहिए ताकि वो प्रॉपर इस ट्रीटमेंट को गाइड कर सके.
This sounds quite an assuring answer, Dr. Nikhil. Thank you so much. Because duration of the treatment depends on what kind of TB you have, and please be persistent with the medication. Do not give up in between thinking that you're fine. Dr. Vishnu, this happens quite a lot of time that people either are fed up or bored or think that they are fine now, they are free of symptoms. And when they leave or quit their treatment, what happens and why is it important to complete the treatment?
Yeah, it's a very good question. I'm glad that you asked that, because one of the common problem, the common situation what we face as doctors is that good number of people, they start the treatment and they stop after say few weeks or few months thinking that they're all fine. So it is not only going to harm them, but it also cause harm to others. How it is going to harm them? See, the normal, if you take the medication properly, straight away you're going to get better in 6 months. If you stop the medication, or if you don't take the medications properly, you are missing 2 to 3 doses per week or 6 7 doses per month. What happens is that the bacteria get resistant. So once you have a disease relapse, you can have a disease called multi-drug resistant tuberculosis. And I'll tell you that is, it's going to be very difficult because now we are going to extend the duration of treatment for 18 months. So with the new drugs, though we have new drugs available, the side effects are more, the toxicity is more. So taking medication properly is one of the most important thing. If you don't take it properly, you're going to spread the disease to others and you're going to land yourself in drug resistant tuberculosis, and where again we need to go for 18 months. Number two, what is the reason? Why will people stop? One of the reason is they feel that they got better. Number two is, looking into the number of pills or the initial side effects which we encounter, that we need to address. So let me quote my example. I had tuberculosis. I have taken tuberculosis treatment for 6 months. In my first few days of treatment, I had some issues which I have to deal with, because my weight is around 70 kgs, more than 75, so I have to take 5 pills. Number one, looking into those 5 to 6 pills, people get scared. Sir, you are giving 6 pills, 5 pills for me. Looking at the number itself, they get scared. Number one. Number two, in the initial part of the treatment, you can have some side effects. For example, you may have some nausea. You may have some urine turning into red. And initial few days, you may have some abdominal discomfort. See, most people will have these side effects in the initial few weeks. With time, they get better. It's only very few people who have, intolerance to the drugs that constitute around 5 to 7%. So when I had tuberculosis, for me, it took almost 2 to 3 weeks for my nausea to subside, for me to tolerate those medicines. So understanding of the side effects, the minimal side effects, what can be encountered, has to be discussed with doctor in details. And once you get those issues, you need to address them. I have seen lot of people, they think, hey, these tablets have made my life worse, so they're going to stop it and they're going to come in a very severe fashion. So patients should understand what are the side effects that are important, and most of them, take my word, most of them are manageable. With time, they get better. So as I telling you, I had 3 weeks, I had little tough time, but after that, I accepted the medications and I'm completely cured now. So I don't want to quote any example, I want to quote my example how I felt. So viewers, please keep this in mind.
Wonderful, Dr. Vishnu. Congratulations on beating tuberculosis and giving us assurance that we can now fully cure it, and you just have to keep going with your medication. And I also hats off to you, to the medical professionals who put yourself before the risk that you can see that it is coming. As an infectious disease, as critical care and pulmonologist, we've seen you brave infections from bacteria to virus to all these contagious diseases. Thank you all, and my respect to the medical fraternity and people like you. Thank you all. So, Dr. Nikhil, here's another. Okay, Dr. Nikhil is not on the show. I request you to, if you can hear me, I request you to refresh and join us back, Dr. Nikhil. So, Dr. Vishnu, here's a question from our audience, Monisha Veeranan. Monisha is 27-year-old female, diagnosed with abdominal TB for 2 months. I've taken 4 drug medicine. Later, I've been given with rifampicin, isoniazid tablet. Now, lately, I've been seeing, yeah, she's seeing small joint pain on her finger bones. Also, she took a rheumatoid test, I suppose. That is negative. Small joint common for abdominal. Is small joint infection common for abdominal tuberculosis? That's a question.
See, in general, when we start people on tuberculosis medications, one of the side effects what we can encounter is a drug called as pyrazinamide in tuberculosis treatment. It can increase uric acid in the blood. So that can cause some joint issues. So when somebody is on TB treatment, we check their uric acid levels. And if somebody has joint issues, we try to give medicine to subside the uric acid levels and alleviate those symptoms. So in general, this is the common cause. So for me to give an opinion, I think I need to have a detailed discussion, but I would recommend the viewer to discuss about this issue with the doctor treating, so that, that will be addressed in a effective way.
Yes. The link to Dr. P. Vishnu Rao and to Dr. Nikhil Modi is already placed in the chat and also description box. With further details, or if you want to consult any one of them, you can just click the link and reach out to them. And Pranav's question, Dr. Nikhil, welcome back to the show. I see you had some technical difficulty there, but thank you so much for joining us back. Pranav is asking this question. Father is 62-year-old male, and is a diabetic, and was weak for more than a year. And later he went for a checkup, and we got to know that he has an MDR TB. And after starting the treatment, his condition has started to go worse. Within 45 days, he's no more. He's not responding to the treatment. I want to know, how much time does it take for TB to become a disease and to MDR TB? First of all, Mr. Pranav, we are extremely sorry to know that you've lost your father to TB. But is this the case? Is TB deadly? ये जानलेवा है क्या? How does one understand? And he's posing a very important question. TB to become MDR TB and to not able to treat it. What was the timeline?
Yeah, sorry, Pranav, for your loss first. But first thing which we need to understand is that there are two possible ways we get an MDR TB. Firstly, the direct infection you have acquired from a person, he might be harboring MDR infection, and when you came in contact with that person, so from the very beginning, the TB bacteria in your body was MDR TB itself. Secondly,
Oh,
as we have been having cases in which an incomplete or improper treatment is taken, the normal bacteria in our body, the normal tubercular bacteria, can get converted to MDR with time. And in your case, father's case, since it was an year before he was diagnosed, he might have received some antibiotics in between, which are in fact used as TB treatment. So that can also impact in converting normal bacteria to TB bacteria. Secondly, already Dr. Vishnu have pointed out that MDR TB, though it is now treatable, even the medications for that have more side effects. So once it was already a year before the diagnosis was made, so early diagnosis and treatment again comes into the picture. So body must have become quite weak. The medicines for MDR are quite toxic. So maybe a combination of that, and maybe the in diabetes the spread of TB to different organs is faster. So all those things combined together might have been the cause of death in case of your father. But
yes.
still, I would say it is a treatable disease if you diagnose it on time and the treatment is started early. If you delay it too much, then obviously we can see deaths also.
It is, doctor. It's the right time and the right treatment and the immunity that you both have been pointing out. Dr. Vishnu, next question I would want to take up is Sadika Syed. Daughter is 23-year-old, female, diagnosed with MDR TB, completed 18 months. 18 months, 9 of her course. Okay, 18 months of her course is completed. Doctors have advised to stop medicine, but now her feet have tingling sensation all the time. How to stop?
Yeah. See, this is one of the side effects Dr. Nikhil Modi was telling about. At least let me tell what is positive. See, 4 to 5 years back, we used to treat MDR TB for 18 months with 9 months of injections. Imagine, we used to give 9 months of 6 to 9 months of injections.
Oh
Now
my.
we move towards bedaquiline based treatment where now it's only tablets. Now, as the time is passing on, we are coming up with new regimes, still not available, but in the next future, we call them BPAL regime, moving towards shift 6 months regimes also. So, as the time is passing, as we are developing new and new drugs, the regimes are getting better and better. Currently, though
Okay.
we are in the bedaquiline based era, still you can get some side effects. So, in the TB medications, there is certain drugs. For example, we typically have a drug called as linezolid, which is a part of MDR TB regime. One of the side effect is what we call is peripheral neuropathy. Peripheral neuropathy, because of these medications, is one of the side effect what we expect in somebody who is on this bedaquiline based regime. And though in this kind of patients we reduce the regime, since the duration is for almost 18 months, they develop certain toxicities. Those tingling and numbness, most of them, can be to a certain extent, they can be reversible by giving certain, what do you say, certain medications or certain vitamin supplements if they have coexisting vitamin deficiencies, but they tend to be there like that, and over time patients should get used to that. See, that is one of the, what do you say, a little downside, I would say, because, if you compare the risk benefit, because the kid has completely got better from the MDR tuberculosis, but it is coming with some cost. And that is, a little side effects which is associated. But I'm going to say that the future is more and more brighter. We're going to get less and less toxic regimes. And hopefully, we'll be dealing more and more patients with less of this side.
जी प्रखर मिश्रा जी, आपका क्वेश्चन जो यूरिक एसिड के रिलेटेड है, डॉक्टर विष्णु हैज ऑलरेडी आंसर्ड इट कि यूरिक एसिड लेवल बढ़ता है वो मॉनिटर करना चाहिए. विल नॉट बी एबल, दैट आंसर इज ऑलरेडी गिवन. देन आल्सो इन्हीं का क्वेश्चन है कि thrombocytopenia in TB patients, why does it happen and how to manage it? Experts, one of you please go ahead.
Yeah. You want me to take Dr. Nikhil? You want to go ahead? You're telling? Yeah, I think I'll talk.
आपका आवाज नहीं आ रहा है डॉक्टर, आप म्यूट में हैं क्या? Please, will you please check? Yes, Vishnu, in the meanwhile, Dr. Vishnu, please continue.
The reasons for thrombocytopenia in tuberculosis patient is, number one, there are certain more causes. One, if the tuberculosis is disseminated and it is involving the bone marrow, you can have thrombocytopenia, number one. Number two, TB medications at times can cause thrombocytopenia. For example, very rarely rifampicin can cause. And I was talking about linezolid. If the patient is on drug-resistant tuberculosis, linezolid can cause, number two. Number three, there may be altogether a different cause causing thrombocytopenia. So we need to evaluate it. So is it coming from the TB, or is it coming from the tuberculosis medications, or is it coming from certain other alternative etiologies? So this has to be evaluated and treated accordingly.
Yes. Now, yes, Dr. Nikhil Modi is also back. Dr. Modi, now Pranav has asked a simple question but a very valuable question. Vaccination for prevention of TB. Ye hamare, of course, we all know that we are given BCG vaccine as a child, but what's the role of it, efficacy of it, and who all are involved in the immunization program?
Yeah. So BCG vaccine is the thing which is given immediately at time of birth. This is the first vaccine which is given. Actually, it is for tuberculosis, but I want to make it clear here, it is only to prevent severe forms of tuberculosis. So its efficacy is just to prevent severe form of tuberculosis. It is not more than that. Many vaccines are still in trial. We might get it in future, but right now they are not. So BCG vaccine doesn't mean that you will not catch tuberculosis. You still can have tuberculosis. It is given early in childhood because if a neonate, a newborn catches hold of TB, he is at risk of developing a very severe form of tuberculosis. So once you give that, the chance of him getting that will be less. Gradually over years, the immunity becomes stronger. So even if it catches hold of the infection, it will be a milder thing. So main efficacy of BCG vaccine right now is just to prevent severe form of tuberculosis. You can still have TB, so don't be in a myth that you have taken BCG, so you can never have tuberculosis.
So that way, as a country with such large population, we do ensure that our children are given immunizations according to the schedule. But अगर ये immunization हमारे देश में सही ढंग से, if that is the case, then we wouldn't have this kind of statistics for tuberculosis. Dr. Vishnu, I've heard that almost 1/3 of the global population is already either affected by tuberculosis or in latent or have been exposed to tuberculosis bacteria. Is that true? And what's the percentage and how alarming is the figure?
That's what. 1/3 of the world population is infected with tuberculosis. See, as Dr. Nikhil was already pointing out, see the BCG, for example, if you check anybody, left shoulder will have a mark here. That is what is BCG vaccine, which has been given in the childhood for all of us. So that is going to protect in the pediatric age group to develop from severe form of TB like TB meningitis or miliary TB, what we call. But that doesn't stop you from getting exposed. So since the TB burden is so much, 1/3 of the world population is infected. And as I already told, out of this 1/3 who are infected, not everybody will develop active TB. 5 to 10% of those 1/3 population, during their entire lifetime, they have a chance of developing active TB. In fact, because of that reason, the World Health Organization or the government of India are coming up with certain new guidelines called treating these patients with a drug called as isoniazid. So giving a drug called isoniazid in somebody who is TB exposed to prevent the activation of the disease in the later point of the life. So to prevent that 5 to 10%. In fact, government or the WHO is thinking of eliminating TB, which is not easy. Though we have a lot of set, it is not easy. So one of the strategy they are following is to give this isoniazid prophylaxis for TB infected patients, for the latent TB patients. But we need to understand that it is not universally followed. Currently, government is implementing in all the government hospitals where if you have an active pulmonary TB patients in the house, since family members are all infected, so the government is recommending this INS prophylaxis to all the family members. Because as I told you, somebody who is exposed, 5 to 10% develop lifetime TB, but out of this 5 to 10, half of them develop in the first 2 years. So government is coming up with this INS prophylaxis to all the family members. But it has, it is not universally followed because it has its own issues. Because we have INS resistance growing in India. And this medicines itself has some side effects. When you give medicine in lakhs of people, obviously the number of side effects, what we see is more. So all these are the burning things currently, or the controversial things that is happening. So, currently we are
I think we
taking this
should take the time for a policy to be framed. These are all time and testing trials and a lot of other policy framing issues to come to larger population, not just one doctor treating or one hospital following a protocol. We will leave it to the government because government has already established programs and protocols that we are all following. So we will leave it to there and let them roll out the plan. So I would want to move on to the next question. The question is already a registered user. Yes, here, where I'm sorry, again, I missed the question. It was all about, yes, Mr. Srivastava, 26-year-old male. TB medicines are liver toxic medicines, according to him, but need to be continued for 6 months. What to be done to shield the liver and repair it from the adverse effects of TB medicines? Dr. Nikhil, would you want to talk about the fear that people have about side effects and organ damage?
Yeah. So, whenever a patient comes to us, we make sure that all the side effects and all the symptoms or side effects which a patient may face, we explain them. First, the most common thing which we tell them is your urine is going to be a red colored urine. That is a normal thing because of the medicine which you are taking. And then obviously the liver toxicity is definitely an issue. So whenever we start a treatment, we get a liver function test at the start. Once the medicines are started, we monitor the during the course of the treatment. And whenever if there is an issue, there are always ways to modify the treatment, and that can be based as per the patient requirement. Because there can be 2 3 drugs during in the regime which can cause this, but a person can have liver toxicity due to one drug and not due to others. So we have to tailor made in that case. And sometimes even if the liver enzymes slightly go up, it may not harm at all. So up to 2 to 3 times, even if the liver enzymes are going up, we continue the treatment under close monitoring, and you should be okay. And even if you are taking a proper diet along with it, as Dr. Vishnu told, that initial 2 to 3 weeks you can have more trouble, but once you start tolerating the medicine, these chance of these side effects are less. And the benefit actually due to this medicine is so much high that if you properly monitor the liver toxicity, you will not get any harm, and you can complete the treatment properly. So your doctor is there to take care of your liver, so you don't worry, and just consult it, and he will monitor the LFT and accordingly tailor made the regime as per the requirement.
Yes, and this is going to be a long relationship between the patient and the medical practitioner, and one should not break this cycle. Keep talking, keep getting back to your referring doctor. So, Dr. Vishnu, here's a question about relapse of tuberculosis. Stephen is asking this question: what precaution one should take so that there is no relapse? And here I would also want you to please give us some insight into what testing can be done, what are the tests, and how long, what are the duration of the tests that one has to take?
So, two things need to be addressed to prevent relapse. Number one, when somebody has tuberculosis, adherence to the medication is the key. Taking medications each and every day without missing and finishing the full course of duration is the key thing to prevent relapse. Number one. Number two is the addressing underlying risk factors. As I told you, TB can reactivate in somebody who has immunocompromising conditions. For example, if the patient is diabetic, his diabetes should be very well under control. If the patient is a HIV patient, he should be on the HIV medications and his viral load should be undetectable and his CD4 should significantly improve. So, taking the medications properly, addressing the underlying risk factors appropriately, these are the two important things to prevent a relapse of tuberculosis happening again. Now, next point is, what are the diagnostic tests that are available for diagnosing tuberculosis? See, it depends on the site. For example, if I am suspecting tuberculosis in the lung, I'm going to ask some sputum. Or if sputum is not possible, we do something called as bronchoscopy. And currently we have a TB PCR test. We call CBNAT. We are doing it for all patients. And we do something called as AFB culture. That means you try to take the sample and grow the AFB. And when the bacteria grows, you're going to ask drug susceptibility testings on it to see what all that drug is working. So this is what you do if it is in the lungs. Say, for example, it also depends on the organ-specific involvement. For example, a lot of people keep coming to me and telling that, sir, I don't have cough, I have tuberculosis. Doctor is saying I have tuberculosis. Didn't even ask my cough sample, the sputum sample. So if, for example, if the TB is in the neck, in the lymph nodes, the test you have to ask from the lymph node biopsy, that same test which I was quoting. And if the TB is in the brain, then you need to take the fluid from the spinal cord and then you need to send the sample. So all these tests should be decided where the TB is, right? You won't get the sample positivity if you have a TB in the brain, and if you ask lung sample, you're not going to get it. So it depends on which organ the tuberculosis is involved, and that particular organ sample has to be taken and ask for this PCR test and AFP culture test. And there is one more thing called as histopathology. See, we need to understand that TB in most of the areas we call paucibacillary condition. That means the organism present in smaller quantities. So at times we may not pick it by AFB culture or the PCR test which I am telling. Those tests can be negative, but you do something called as histopathology where you look for the body reaction. You see something called as granulomas. When TB is there, the body forms something called as granulomas. So even with that also we treat it as TB. So a lot of people comes to me and tell us, sir, my TB test is negative, but still my doctor is saying it is tuberculosis. Because at times you may not pick up them because of the low bacillary condition. So always, this test has to be done, and this to be and the patient should have an in detailed discussion with the doctor, and the decisions should be made accordingly.
एंड लाइट मत लेना दोस्तों, जो भी देख रहे हो इसको सीరియస్లీ లేనా. ఇది తేలిగ్గా తీసుకోకండి. ఇది ఎంత గ్రావిటీతో ఉన్న ఇష్యూనో మనకి అర్థం కూడా కాదు. దీని లోతు అర్థం చేసుకోవాలంటే దయచేసి మీ మెడికల్ ప్రాక్టీషనర్తో రెగ్యులర్గా డిస్కస్ చేయండి. తెలుగు అర్థం చేసుకునే వాళ్ళందరినీ మళ్ళీ మళ్ళీ విజ్ఞప్తి చేస్తున్నాం. ఒక రోజుతో పోయే ట్రీట్మెంట్ కాదు, 1 సంవత్సరం పట్టచ్చు, 2 సంవత్సరాలు పట్టచ్చు. కీప్ అట్ ఇట్. డాక్టర్ విష్ణు గారు లాంటి వాళ్ళు మనకి మార్గదర్శకత్వంలో వాళ్ళు ముందు జయించి మరీ నడుస్తున్నారు కాబట్టి there is possibility that we can fully cure it. Dr. Nikhil, here's an interesting question. Pranav and Gopinath NS, both of them are asking, TB bacteria, can it mutate like how coronavirus is mutating? To Gopinath NS, can military TB cause SARS and then cardiac arrest?
Okay, so tuberculosis bacteria do mutate. That's why they convert from a normal bacteria to MDR, but it is not similar to as COVID does. COVID, the viruses are fast multiplying, fast changing, and they can mutate within months to years. The mutation in tuberculosis, they are very slow growing, and the mutations are very, very slow. So we see resistance developing due to the mutation only, but that is over many years. So if we say the MDR things which we already have, they have been there for almost more than 10 years now, and new mutations we have not been able to see. They do mutate, but they don't mutate as the COVID thing. And there is a form of tuberculosis which we call as miliary tuberculosis, in which the bacteria goes into the blood. From the blood, it is then filtered out into the lungs bilaterally. So small nodules become there, and that causes lot of fall in oxygen. So it is not similar to a SARS thing or that, but fall in oxygen can definitely be seen due to tuberculosis. Tuberculosis can also involve heart. It can form a fluid around the heart. It can cause heart to get compressed due to the fluid accumulating there, and that can cause cardiac dysfunction, cardiac arrest too. So these are never similar to what viruses does. Viruses are totally different way they affect the organs, but definitely lack of oxygen, just like in cases of COVID, or a heart issue can be seen due to tuberculosis as well.
Such powerful information, doctor. Thank you for throwing like that. डॉक्टर विष्णु, हियर्स विजयपाल सिंह, 30-year-old मेल. अच्छा, शायद विजयपाल सिंह जी को हिंदी में आंसर चाहिए था, तो आई पोस्ट दिस क्वेश्चन टू डॉक्टर निखिल मोदी. ही इज मोर कंफर्टेबल इन आंसरिंग दिस. 30-year-old मेल है, मेरे राइट एंकल में बोन टीबी है, ऑलरेडी ट्रीटमेंट 18 मंथ हो चुके हैं, बट नो क्योर. इसका क्या टाइम लग सकता है?
विजयपाल जी, अगर आपका टोटली आप कह रहे हैं क्योर ही नहीं हुआ, तो सबसे पहले तो आपको डॉक्टर जो है आपको वो डिस्कस करेगा, क्योंकि अगर 18 महीने में भी कम नहीं हुआ, इम्प्रूवमेंट नहीं आ रहा, तो एमडीआर टीबी ना हो और आप नॉर्मल टीबी का ट्रीटमेंट ले रहे हो. बोन टीबी का जैसे मैं बता रहा था, कई बार 18 महीने और कई बार 24 महीने तक भी ट्रीटमेंट में टाइम लग सकता है. तो अगर 18 महीने में आपका इम्प्रूवमेंट आ गया है, तो आई थिंक यू मे नीड टू कंटिन्यू ट्रीटमेंट फॉर 6 मोर मंथ्स और आप ठीक हो सकते हैं. बाकी आपका डॉक्टर पूरा असेस करके गाइड करेगा, और अदरवाइज एमडीआर टीबी का वर्कअप की जरूरत हो सकती है. और आई थिंक आप डॉक्टर से कांटेक्ट में होंगे, वो पूरा असेस कर रहे होंगे और उसके हिसाब से दे विल गाइड यू.
Thank you so much, Dr. Nikhil. Dr. Vishnu, here's Arjun's question. How long does it take to recover from a spine TB?
Yeah. So, as already been discussed, the tuberculosis in the bone requires longer duration of treatment. It also depends on how many vertebrae are involved. For example, we have few patients, only one vertebra is involved. The disease is minimal. If they come early, if the diagnosis is made early, they can recover as early as 4 to 6 weeks and they can get back to work. For example, if the patient has come late, which is involving multiple spine bones that we call vertebra, and these are the patients who take longer time to recover. We have patients who come in the late stages where the vertebra is involved, multiple levels, and it is cause compression of the spinal cord. People even come in paralysis, bilateral low leg paraparesis we call. So if somebody comes such a late stage, it takes long time to recover. If the patient comes earlier, the diagnosis is made earlier, the patient can back to work within 6 to 8 weeks.
Yes. Next question is, how can we diagnose latent TB? Gautam Sairam is asking. Dr. Nikhil, would you want to answer?
So, as we have discussed that latent TB, the bacteria goes, the body mounts an immune response, due to which a granuloma, a localized area is formed where the bacteria is contained and it is not spreading. So, to diagnose that you have been exposed and there is bacteria in your body, there are two tests. One is the Montauk's test, in which an injection is applied with the antigen, and then we read the presence of positive induration, that is hardening around that, in 48 to 72 hours. And there is a TB gold test, in which a blood sample is taken, and if it is positive for that antigen, that means your body has been exposed. And if these are positive and you don't have any clinical symptoms, then you label this patient as latent tuberculosis infection.
Achha. Thank you so much. Dr. Vishnu, as we're coming close towards the end of the show, I would want you to give us quick answers to these questions. I have a lot of questions. Is there any relation between tuberculosis and cancer?
No, in general, tuberculosis doesn't lead to cancer. Most of the times, it is if you treat appropriately, the patient gets healed of tuberculosis and it is unlikely to turn into cancer.
Yeah, thank you so much. Dr. Nikhil, here's a registered user. Yes, doctor, please go ahead.
Yeah. So, as Dr. Vishnu has rightly said, that tuberculosis can never cause cancer. But sometimes what we see in clinical practice in our respiratory setup, that the scars, sometimes TB infection leaves scars behind. So these scars later on, because the area is damaged, so they later on can show a presence of cancer there. We have seen scar carcinoma. That is unrelated to the tuberculosis infection, but your scars can later on turn into a cancer area, and these scars can be due to any infection you should find. So
Right.
Maybe that's why some patient might have got a scar of TB and later on cancer. That's why this question will have popped up.
Must be
So
the
just
question
wanted to
must have
add.
come. Oh, yes, doctor. Thank you so much for throwing light there. Dr. Nikhil, how to cure post-tuberculosis asthma and allergy? This is a registered user's question. And also, Mr. Sean David is asking, are COPD and TB interrelated?
Uh, okay. Two questions. Firstly, about asthma. Firstly, tuberculosis doesn't cause asthma. Asthma is an allergic condition. It has no relation with tuberculosis. Now, in tuberculosis, what happens? Sometimes the pneumonia or the cavity formation which occurs in tuberculosis in the lungs, once it heals, it leads to scar formation, which we call as fibrocavitary changes, which are healing TB can leave behind. So these scars, what causes? It causes lung capacity to go down. It causes airway remodeling. Your windpipes become remodeled, due to which you develop asthma-like symptoms or breathing issues, for which treatment may be similar to asthma, but it is actually not asthma. And also some people label can communicate as it as asthma or COPD. That's why the asthma in TB or COPD link in TB comes. Second important correlation with TB and COPD is that smoking risk increases the risk of COPD, as well as smoking is an important factor which increases this for tuberculosis as well. So that's how they are linked. And post TB scar patients have symptoms similar.
Yes. Your line, I think, is again frozen. I will wait for you to rejoin. In the meanwhile, Vishnu Garu, we will also continue talking about the same thing. Post tuberculosis asthma allergy ho gaya na. Next question I wanted to take up is about going back to work. Can a person with TB go back to regular work normally, and when can they go back to work? What are the risks and risks for co-workers?
Especially, I would tell my all the patients typically at least wait for a month before going back to work, especially if the tuberculosis in lung. As I told you, a minimum 2 weeks of TB treatment is required for them to become non-infectious to others. And other thing is that I'll ask 1 month time, because in the first few weeks, patients should also get adopted to the medications. As I told you, the so-called nausea and some vomiting and some related events will be there in the first 2 to 4 weeks. So I typically say most patients with lung tuberculosis to at least wait 3 to 4 weeks for them to get back to work. Once their appetite picks up, once their weight start putting on, once they tolerate the medication, and minimum 1 month is over, I think they should be good going back to work.
1 month is a good time, and do take care of yourself. And I'm surprised that not many people have asked about their nutrition, loss of weight. I was expecting a lot of those questions, but some reason I couldn't see any of those questions. We'll come back to you, Dr. Vishnu, about those questions. Dr. Nikhil, would you want to complete the COPD and TB connection?
Yeah, so the damaged lung which we have, that behaves just like a COPD case, and that's how they develop symptoms similar to COPD. And obviously, the smoking thing is a risk factor for COPD as well as for tuberculosis.
Yes, doctor. Here's another question from Suraj Thakur. Pooja's 30-year-old female. However, April, they got to know that CT scan revealed multiple enlarged, heterogeneously enhancing mediastinal, bilateral, hilar lymph nodes in the right lung. Okay, and is it harmful? What should be done to correct the process to take it up? Doctor, this is too much of technical term for me.
Yeah, so lymph nodes, as Dr. Vishnu have already told, those nodes which can appear there, they are basically collection of blood cells only, which helps to fight infection. So whenever you get an exposed to infection, these are the sites where infection can harbor, and they increase in size. So once you have lymph node, you take a biopsy from there. According to the biopsy, there can be multiple diagnoses like tuberculosis, sarcoidosis, lymphoma. So as per the report which comes, whatever thing has come, you start the treatment accordingly, and then you will be healed accordingly. So even if you pick up tuberculosis in that, so the treatment remains the same.
All right, thank you. I love my team because they have put a link to the right diet to keep TB in check, and to know you want to know more about diet and nutrition and etc. They have put a link there to a blog article that Apollo 24/7 has. This is going to be important. So we will now wind up because we have two specialists, and we would want you to give good in-depth answers for our top tips. Dr. Nikhil Modi, I would request you to first give us top tips to understand and manage tuberculosis.
Okay. So to first start, tuberculosis is totally a treatable disease. Early diagnosis, proper timely treatment, regular treatment goes a long way in taking care of tuberculosis. Don't be afraid. Don't wait. Go to your specialist on time. Once you are diagnosed early, the treatment is successfully completed, you will be cured of the disease. Also, for MDR TB, there is a cure. Even if you catch hold of MDR TB, if you timely start the treatment, you again will be cured well, though the side effects with the medicine may be more. Also, focus on proper diet. If you have any illnesses like diabetes, HIV, any other comorbidities which increases the risk, get a proper hold of it. Take medicines for that on time, because that will go a long way in helping cure TB in your case. Thank you.
Thank you, Dr. Nikhil. Before I ask Dr. Vishnu his top tips, here's one question that has come towards the end of the show. Reema Chowdhury, 35-year-old, she's asking, is TB transmissible only when you are in close contact with an active patient, or even if I walk past or walk through a place, it was earlier passed by a TB patient, do I get it?
In general, TB is transmissible by prolonged close contact. That is what is required for TB transmission. In general, it's a prolonged close contact. If you ask theoretically, if you just pass by, see, if you are in a place where there is good ventilation, free flow of air, probably that is not going to transmit. But when you are in closed rooms where there is no proper circulation is not there, then probably even with a shorter contact period, you may get infected with TB.
Okay, okay. And also, Dr. Nikhil, I think यहाँ पर एक मैं region, caste and all other specific question भी लेना चाहती हूँ. पहले सोचा जाता था कि TB एक क्या बोलते हैं the poor man's disease समझा जाता था. That we clearly know it's a myth. कि इसके बारे में आप कुछ add करना चाहते हैं?
Yeah, actually, poor man disease इसको इसलिए बोला जाता था क्योंकि most of the people who are poor or below poverty line, they stay in smaller rooms which are not ventilated, so, and in close
Spread rapid हो
community,
जाता.
तो स्प्रेड रैपिड हो सकता है, तो इसलिए उनमें एक केस होगा अगर एक कम्युनिटी में, तो स्प्रेड होने का आसपास बहुत ज्यादा चांस होता है, फैमिली के अदर मेंबर्स को बहुत ज्यादा चांस होता है. So that is what's the reason. So if you maintain adequate ventilation and lighting, the air keeps on changing, then the spread becomes less. That's why it was used to be called like that. But definitely
But
TB can be acquired by anyone, anywhere.
now the urban scenarios, we're all sitting in the closed AC rooms. We are all
Yeah.
sitting and working in ventilated. We think that we are ventilated, but we aren't. Vishnu garu, are we also at risk while we work in the AC contained rooms?
Yeah, this
Yes,
is actually
that
a problem.
unfortunately, yes. Yeah.
Yeah, AC is a major problem. We need to look at our aesthetics again, ergonomics, aesthetics, and working spaces again in terms of COVID, tuberculosis, and other infectious diseases as well. Thank you, Dr. Vishnu. I would now want you to give me top tips of importance of continuing the drugs, the therapies, the treatments.
Yeah, tuberculosis is very well manageable condition. So identifying the disease is the key. You have fever, weight loss, loss of appetite, and cough for more than 2 months. And if the TB is outside the lungs, you may just have fever, weight loss, loss of appetite. So when you have these symptoms, always talk to your doctor. And once the TB diagnosis is made, treatment is of utmost importance. Mind you, adherence to the medications is the key. You should take the medications each and every day. And in the initial phase of the treatment, you may encounter some minimal side effects. Most of them are manageable. Please talk to your doctor and address them and take adequately for 6 months. You're going to be fine. So in case of in case of delay treatment, TB can be danger, and it can increase the mortality. So always identifying the disease and talking to your doctor, and treatment is the key.
Wonderful. Thank you to these wonderful experts, Dr. Nikhil Modi and Dr. P. Vishnu Rao. Thank you so much for giving so much of enlightenment and awareness in this compact discussion. And we're looking forward to having you more on the show. Thank you once again. Namaskar.
Thank you. Our pleasure.
Thank you.
So now time for health quiz. I'm going to ask you 3 questions. You can answer the questions on YouTube chat. Winner's name will be announced at the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. If I have taken your names to be the winners, and you have to write back to us by the middle of the week, by Wednesday, with all your name, contact details, phone number, etc. to marketing@apollo247.com. Gift vouchers and health credits will be shared with you. Here are the questions for this week. Fill in the blank. 1/4 of the world's population is infected with T से शुरू होता है, C and S बीच में है, bacteria. 1/4 of the world's population is infected or exposed with T से शुरू होता है, bacteria. Fill in the blank, please. बीच में C and S भी है. Question number 2, true or false में answer कीजिए. On 26 September 2018, the United Nations held its first ever meeting on TB. Is that true or false? Question number 3, yes or no में answer कीजिए. Does cough that lasts more than 3 weeks indicate TB? Yes or no में answer कीजिए. Does a cough that lasts more than 3 weeks can indicate tuberculosis? So I'm waiting for your answers. Please do type in. I see that a lot of people are typing answers. We shall wait to find our winners. And here are health coupons, gift coupons, and the coupon codes that you can use on Apollo 24/7. I strongly urge you all to download Apollo 24/7 app and use these coupons there. You can consult top doctors direct from Apollo and get up to 150 rupees cash back on online doctor consultation. And the code you have to use for this is AskDoc150, AskDoc150. And terms and conditions, of course, apply. Download Apollo 24/7, use the code to consult doctors. And the next coupon that we are giving away is First 3. Code First 3 hai, get up to 25% off on online medicine orders. When you order medicines direct from Apollo, you also get a 2-hour delivery too. So code First 3 applies on orders above 1,000 rupees and on the first 3 orders of medicines above 1,000 rupees. HH247 is the next code that we are giving. Use this code exclusively. This is for Health Hour viewers. You get up to 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. You can use HH247 in addition to the other coupons that we had given earlier. Thank you. And in case that you want to order medicines or book tests, Apollo 24/7 is just a call away or a text away. You can call or text on WhatsApp as well. 09355 247 247 is the number. You can avail healthcare services with WhatsApp as well. And next week, by the way, we are going to talk about an interesting subject, diarrhea in children and adults. How do you manage in different age groups? अभी summer आने वाला है आ भी चुका है. South India में, North India is still struggling with rains. So both conditions, in the rain, in the humid, in summer, diarrhea is going to be a challenge to manage. We shall talk about diarrhea in children and adults in the next week's episode. I'm waiting for my winners to be announced by the team. Yes, I can see our regular participants also. Jolly, Simran Singh, Harminder Kaur, Anmol Ratan Singh, all of you have come back. Rakshak, you also have come back to participate. It's good to see our Health Hour viewers participate regularly, joining us every week, asking pertinent questions, and also participating in the health quiz. Feels good to see you all back every Sunday. So, yeah. And I see some seasoned answers also, all 3 into 1. Still waiting for our team to pick winners. In the meanwhile, let me quickly reiterate what we talked about tuberculosis. Tuberculosis can be treated and we can fully cure it provided you take a full course of drug and not stop it. Alright, the winners are here. Congratulations, Harminder Kaur, Arjun R, JS Chana, Chanana. I'm repeating your names: Harminder Kaur, Arjun R, and JS Chanana. You have to write back to us by Wednesday this week with your name, contact details to marketing at apollo247.com to claim your prizes. Thank you all. Fir milte hain next week. Namaskar.